channel. And since this is a corona pandemic period, and from today onwards, um, I've been from the last few days, I have been taking up the important questions what are mostly associated with the corona symptoms. So, in one of the some of the patients, some of the viewers, they have constantly been asking that they have a common symptom like they have a complete loss of smell and taste. See, whenever there is any kind of a viral infection, most of the times it happens that it is going to affect the olfactory neurons, the neurons what are affecting the sense receptors. So there are olfactory receptors what are present in the nasal area, and it has also been found that whenever any kind of a trauma is there, any kind of a head injury is there where the it has inflicted a wound on the nasal mucosa on the nose, in certain conditions of head injury where the nose is getting where the nose has been inflicted by a where the nose has been traumatized, it has been found that the smell of the person goes. And so it holds the same whenever then any kind of a viral infection is there. So since this is a coronavirus, it enters, it gains access into the body either through the nasal passage or and slowly and gradually once entering through the nasal passage, it can either go and affect the nasal mucosa, and if it gets down, it can affect the oral cavity. Slowly and gradually the virus progresses either into the food pipe or the windpipe, and there it causes scars, there it causes erosions that is going to damage the respiratory mucosa or the esophageal mucosa, and ultimately the person manifests very many symptoms. So today's video I'll be mainly focusing upon a very important most common problem what is mostly seen in most of the COVID patient is that they complain of there is a loss of smell. So this loss of smell in medical terminology, it has been called as parosmia. Parosmia, it is a condition where there is a loss of smell sensation. So the patients, it has been found that a total loss of smell and taste, they are the hallmark symptoms of COVID-19, and it happens that 25% of the at least 25% of the people who catch the SARS-CoV-2 virus, that is the severe acute respiratory syndrome coronavirus 2, the people, the individuals, that at least 25% of the people who who catch this virus, they are going to manifest a symptom, that is they are unable to make out the smell. They are not having any kind of a taste sensation. They cannot feel the appropriate taste of a particular food item. And the smell, they are going to feel some unpleasant smell in their surroundings, or there can be an absolute complete loss of smell sensation. So it has been found, and these there are, see, whenever we say anything, there has to be certain studies. So there are studies what have clearly indicated that this COVID-19 infections, it leads to parosmia, that is a complete loss of smell sensation. It has been found, and in some cases it has been found that there is complete loss of smell, which is called as anosmia in medical terminology, from the for the COVID-19 patients. And the senses of smell and taste, they go, and after a certain period of time, once the olfactory nerves what are responsible for the smell sensation, they have the power to regenerate by themselves. So after a certain period of time, it has been mostly seen that most of the 90% of the COVID-19 patients, after a period of 6 months, they recover their smells, original smell sensation, as well as they recover with their taste sensation as well. So the senses, they go and they come back to normal after a certain period of time. So now, how is the COVID smell? So in the COVID smell, what do we find is that the patients who mostly are having the symptoms of COVID-19, they mostly say that some kind of a smell, what they feel is, it is a foul smell, a foul smell, a rancid smell. See, when certain things, fresh fruits are there, fresh vegetables are there, they have a certain kind of a pleasant and a fresh taste. So rancid smell is that kind of a taste where it's that kind of a smell that is mostly seen due to certain kind of a degradation of certain chemicals what are present. So rancidity of butter you must have heard. So rancid is a type of a chemical odor, a foul odor, what is mostly seen from unfresh items, or what the things are getting rotten or from stale items. So the COVID-19 smell, the COVID smell is somewhat foul, it is somewhat rancid, and it is somewhat very similar to the smell of rotting flesh. So most of the COVID-19 patients, they complain of such kind of a smell. And do remember, it's a very good sign. It is a very good sign in COVID-19 patients that they should make merry about it, because once their smell has gone, it's a clear indication that these patients are not going to die. They will slowly and gradually, after a certain period of time, they will recover. See, why it is called a good sign? Because it has been found that these COVID-19 patients, when once the virus has attacked the nasal mucosa, so this virus is going to adhere to the nasal mucosa, and it has damaged the olfactory neurons. Now, since the damaging of the olfactory neurons has taken place, means there is going to be activation of the host's immune system. Now, the host immune system is getting activated, and this activation of the host immune system is going to confer them the immunity towards the COVID-19 virus. So it is a very good indicator that these patients are certainly going to recover, and they are not going to die. They will recover in a certain span of time. So it's a very good marker, because these neurons, after a certain period of time, they are going to regenerate. So the senses can come and go, and in certain individuals, this altered sense of taste, accompanied by the sense of loss of smell, is there for a continuous period. It can last up to weeks or months. So do remember, along with the loss of smell sensation, there is presence of a loss of a taste sensation. And most of the times, these patients, if they are given a banana, instead of having the particular taste of that particular banana, they're going to have certain kind of a foul or a rotten smell. And most particular, the taste distortion, what is there is, it is mostly seen for certain, the worst offenders. What are mostly seen with regards to the taste sensation, it is the fried foods, the eggs, the coffee, and the chocolates. Their taste is somewhat very awful. So these patients, they mostly complain that such things, they smell like hell, and the taste becomes awful. So slowly and gradually, this has affected the gustatory neurons, and there is from the olfactory neurons, the virus have entered either in the oral cavity, and there they have damaged the receptors of the oral cavity for the taste sensation. So they cannot make out the taste sensations as well. So it has been found that the 7% of the individuals in a study, it has been found that they reported of distorted smell of sense of smell after COVID-19 infections. And now, see, once we have a very good smell, a pleasant smell helps in building up a good appetite for us. It helps in building a good mood. See, if it is a pleasant smell, what happens is, a good smell can often lift our mood and bring joy in our lives. Common finding. And since these COVID-19 patients, they have a loss of smell, they have a distorted smell, so that is going to certainly adversely affect their quality of life, and this can lead to there can be loss of appetite. Since the food doesn't smell good, they cannot taste the food good. The food doesn't taste them well. The taste of the food becomes awful. It is not as pleasing. So what is going to happen is, ultimately, such patients with a distorted smell and taste sensation, it can lead to a loss of appetite. It can lead to weight loss ultimately. And certain, if the mood is not elevated, they have an unpleasant smell, they have an unpleasant taste. So ultimately, that is going to cause depression and mood swings as well. So moving on, this was one, that is parosmia. Another medical terminology what is being related to in this COVID-19 patient, it is phantasmia. So phantasmia, it is a condition where phantom smell. So it has been referred to as an olfactory hallucination. Olfactory hallucination means it is a kind of an illusion of certain things what are not present. The patient may feel certain smells what are actually not there in the surroundings, what are actually not present in the environment, and still the patient can have certain kind of a smell of certain things what are actually not present. So this phantasmia is actually when the smell receptors, they hallucinate and they detect certain odors, certain smells that are won't be there, and it isn't constant. At certain period of time, they can feel that some kind of a rotten smell, some kind of a unpleasant smell is there around them, and the things what are not present in the external environment, they could smell them. So it is a come and go phenomena. At times, such patients, they can feel it. At times, they cannot. So it is a come and go phenomena. Some people, some COVID patients, they mostly say that they are smelling cigarette smokes. They can feel constantly, or they could smell like certain kind of a garbage. So certain garbage is rotting in their surroundings. Actually, it is not present in their surroundings. So such patients, they are mostly complaining of this phantasmia or the phantomosmia, which is particularly an olfactory hallucination and olfactory illusion. It is just an illusion. It has nothing to do with reality, and they have such kind of a smell, which is phantasmia. So, it in some moving on, this parosmia, and it's actually a very good indicator. It's a very good sign because the sense of smell is returning. So in another way, if it is if COVID-19 patients, they are manifesting this parosmia and the loss of smell is there, it is clearly indicating that the virus has affected the olfactory neurons and the host immune system is getting activated, so the virus cannot damage the other further organs. So it is a very good sign. The sense of smell, it's the clear indicator that the sense of smell will return after a certain period of time, and it's a good sign. Now, moving on, in many ways, this having a parosmia in COVID-19 or any other viral upper respiratory tract infections, I would like to emphasize, whenever there is any kind of an upper respiratory tract infection by a virus, viral upper respiratory tract infections, or in conditions, in viral infections like COVID-19, if parosmia is there and which is causing a smell loss, is actually a kind of a good thing. You should celebrate, you should make merry about it. It's a kind of a good thing because it suggests that you are making new connections. So the new neurons, they are getting built up, and there is all regeneration of the olfactory neurons, the neurons which are particularly providing the sense of smell. So those olfactory neurons, the olfactory tissue is getting regenerated, and slowly and gradually, within a period of 6 months or so, the patient will come back, will recover to their normal sense of smell and sense of taste. So when looking at the treatment modalities, see, these are the most of the times in COVID-19, the doctors are prescribing the corticosteroids drugs. And these corticosteroid drugs are the drug of choice which helps to cure the symptoms, the loss of sense of smell and taste. These corticosteroid drugs, they are going to lower the inflammation, and they are going to treat this loss of sense of smell and taste as well. So these corticosteroids drugs, they are being mostly prescribed by the doctors, and for the smell loss, it has been prescribed, but there are certain side effects as well of using corticosteroids, such as this fluid retention, high BP, and these corticosteroids can even cause mood swings and behavior upsets. So these are the side effects. But nowadays, do remember, I would like to emphasize, because now researchers have continued certain studies, and now the most important, the treatment for these COVID-19 patient is smell training. Do remember, it is a very, very important um, in the research articles, they have mentioned that for these COVID-19 patients, the best treatment modality is smell training. So what is the smell training? A smell training, it is a process that involves the patient is asked to sniff, the patient is asked to smell certain at least 4 different odors twice a day for several months. So this sniff training is 100%. It's a very cheap, it's a good, it is a simple, and it is a method of treatment which is absolutely free of side effects. And it is the best treatment option for various cases of smell loss, including the COVID-19 virus. So this smell training, it's a very important nowadays. The researchers, the scientists, they have recommended that it is not the smell training should be the treatment option for the loss of smell in COVID-19 patients and not the corticosteroids. Do remember, I'm again emphasizing, researchers, they have found that this smell training should be the treatment protocol, should be the treatment option for the recovery of smell in COVID-19 patients and not the corticosteroids. And what is the smell training? The person is asked, the patients are asked to smell 4 different kinds of odor twice a day for several weeks and months. And slowly and gradually it has been found that it has given very good results, and these good results can be attributed that slowly and gradually it is a cheap method, it is without any side effects. So the smell training should be the treatment protocol if there is a loss of smell or taste. So viewers, this was a very short video where I've tried my level best to what is the medical terminology, that is parosmia and phantosmia. Parosmia is the complete loss of sense of smell, whereas phantosmia, it is a kind of a smell sensation. It is a hallucinating smell sensation. It is an illusional sense of smell, what is actually not present in the surrounding. So the COVID-19 patients, they mostly suffer from this parosmia and phantosmia. If you still have any queries or comments, you're most welcome to comment me in the comment section. And viewers who are new to my channel and they haven't subscribed yet, go do subscribe my channel, and don't forget to press the bell icon so that you can be further updated for my upcoming videos. Thank you for watching.